How many grafts do I need? I don't want the implanted area to be more dense than the rest of the scalp. I got different answers from a few different doctors. The 2014 hair appears thinner than it is because of flash, being long unwashed, and telogen effluvium from hopefully cured irritable bowel syndrome. I of course don't want the implanted area to be more dense than the rest of the scalp. And I don't want to lower the widow's peak, just fill it in a little. I am large, extra large, 23 to 24 inch hat size. What might be density now, implant density, and survival rate? Thank you. Mark.
Thank you for your question. You have submitted some photos with a drawing to show where you want your desired hairline to be. And in your history, you described that there is a recent photo where you appear to be thinner, but it was most likely the result of a telogen effluvium related to irritable bowel syndrome, and that you want to get an idea of how many grafts you would need to fill the area that you want to fill. So you have the 2009 photo and you have the present photo. And understand that you are concerned about not having the grafted areas looking more dense than the ungrafted areas. So your question is very logical and very clear, and I see how you're confused because you're getting different answers from different doctors. The hair transplant field is a very interesting field. There are endless claims made by hair transplant surgeons about their techniques and the number of grafts being superior to whoever their local competitor is. And to help our patients understand the realities of hair transplant surgery, we have a very straightforward process in our practice, and I'm going to share with you what we do when someone like you comes in and help you understand the context of how we do what we do. First, there's a desired area to fill. So that's how many grafts do you need? Well, we measure that. We measure that in square centimeters. And when you measure things in square centimeters, it becomes very clear that whatever you think is a little is a lot more than you think. So you think of that as an expense. Then we look, most importantly, at the limitations of the area where the hair will come from, the donor area. The donor area is this band of skin, hair bearing, that is in the back of the scalp. And when you think of the baldest man you've ever seen, someone who is a Norwood 7, you know that there's this narrow band of hair that never goes away. That is the genetically resistant area. That is the true donor area. And that donor area is the bank that is needed to fill or provide for the expense. So when you think about it in those terms, what other factors are also important? Well, a critical factor is density. The same length and width of an area, whether you're doing a follicular unit transplant or a traditional strip method versus an FUE or a follicular unit extraction, you are dependent on a certain limited area and the amount of density, the number of hairs per square centimeter. So what we do in our practice is we'll literally draw those same squares, those 1 centimeter squares, or we'll estimate based on what we typically do, which is a strip method, and estimate how many hairs we have available to graft. Fortunately, most of the time we are surprised to find that there are more hairs than we originally estimated. But this brings up a more significant point than just how much you need to fill the area you desire. There is question about what your age is. How fast are you receding? When is it possible that you will need another transplant? See, this is the reason why hair transplant is intrinsically flawed in its ability to make someone happy long term, because people keep still having thinning hair. If you ever see someone at a restaurant who has that pluggy look, or you meet somebody and you look at these little hair plugs in the front and you wonder, who could have done that? And why does it look so obvious and fake? Well, most likely that person had existing hair between those hair transplants. And if they were not able to take medical therapy such as finasteride, or they continue to thin in spite of being on finasteride or because they just didn't take it, then that left the hair grafts. And that is a critically important factor for you. When we do hair transplant, and again, the claims that are made are out of control. You can only put so many hairs in a square centimeter, and they are individually determined based on the intrinsic anatomy of a particular person's hair follicle. So if their hair follicle, the hair shaft and the whole follicular unit is someone who has thicker hair, wavier hair, curlier hair, then you can't fit as many in a square centimeter compared to someone who has finer and thinner hair. So claims of putting up to 100 hairs per square centimeter, 60, 80, whatever the numbers that get thrown around, always has to be tempered with what is the intrinsic nature of the hair. You can only fit so many hairs, and each hair has to have a surrounding amount of tissue that will allow for it to grow and survive. In our practice, we actually maximize what we believe is the survivability, because we know that although you can move a lot of hair, you can also have a problem with the survivability. We've had patients who've come to our practice who had mega session surgeries where someone did several thousand grafts at one time, and they've had 90% loss from another practice where they did not factor in the patient's blood pressure, and the patient ended up bleeding a lot more, or the patient may have been on blood thinners. The fact was that they put in thousands of hairs and they got barely 10% survival. So in our practice, what we do is we manage blood pressure. We provide IV intravenous sedation because we're a full body cosmetic surgery practice, and so we do IV sedation. And we will also use a material called extracellular matrix to maximize the graft survivability. Another important point for you is not only about getting the density, is related to the density that you're looking for. It is very difficult to mimic nature's beautifully dense density with one transplant when you're lowering a hairline. More often than not, a person who wants a certain amount of density will need more than one transplant. So you have to look at that harsh reality of hard numbers. Factor in the possibility of additional thinning. So if you haven't explored ways to manage your thinning hair, let me tell you a little bit about what we do for our patients when they come in for this type of consultation. If I see that there is miniaturization and that it appears that they are continuing to thin, which is statistically likely for someone who's already experiencing hair thinning, then we will offer them medical therapies such as finasteride and minoxidil. Unfortunately, a lot of people are hesitant to take finasteride because of the potential of long-term sexual side effects. So the majority of patients who come to us actually choose an option we developed called hair regeneration. Hair regeneration is the use of an extracellular matrix that's used for wound healing, that we developed a formulation, a method of delivery, a technique to actually long-term reverse the hair thinning process. It is essentially using your adult stem cells to repair the flawed mechanisms in the cells and signals needed for hair growth. Unfortunately, the questions of what causes hair loss have not been fully answered, and the mechanism of hair growth still remains with missing pieces to the puzzle. We have a lot of pieces, we don't know all of them. This happened to be a very serendipitous discovery based on an accidental observation of a man who got a transplant and his thinning hair became thicker. So hair regeneration is also an option that you can look into. My advice would be to really get the hard numbers of density and the amount of hair that you would need. And in our practice, we actually defer hair transplantation on someone who is actively thinning. We actually treat them first with hair regeneration, see how much density and volume they get back, and then if they need more hair, well, we can be confident that they won't continue to thin, at least for the 5-year time frame that we have experience with hair regeneration, that they will be stable and they will be able to deliver a realistic and natural appearance. Unfortunately, hair transplant is one of those areas where a person can look good for a while, but if their hair keeps thinning, then they can look like they had plugs, or they had that pluggy look, or they end up being committed and forced to have to do more transplantation. So you want to make these decisions with the full understanding of what you expect from the transplant, if you choose to do it, what your anticipated care plan will be, and look at the alternatives before you just move forward. Because remember, the donor area is a limited area. It's a limited bank account, and you can't spend it forever. And eventually it'll tap out. So you want to be very, very careful about how you strategize your hair loss treatment plan. So that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.